3D mammogram is a special, still relatively new mammogram that we have, and at Jefferson Radiology we perform only 3D imaging. So it has the highest resolution of any mammogram machine on the market, and it's really helped our doctors find the tiniest breast cancers. And as we all know, early detection really helps save lives. And it's also a big time difference, which is the other thing that a lot of people don't realize. So a 2D mammogram is basically 4 pictures for the doctors to review on average. A 3D mammogram is about 200 pictures for a doctor to review. So it's a lot more images to review. And the images themselves are really tiny. So they're 1 millimeter tiny thin slices through the breast tissue itself, which gets rid of that overlapping issue that used to obscure breast cancers on the 2D imaging. So it really helps doctors find more cancers. At Jefferson Radiology, we actually make a 2D mammogram from our 3D images, which really decreases the radiation exposure to the patient, because unfortunately we do use x-rays to make the mammogram. So that's, I think, what really helps set us apart, is that the patient's in and out faster. Who wants to be in the mammo machine longer than they have to be? So it's quicker on the patient side. They can get in and get out, and then the image quality is better. So the recommendations have changed quite a bit, as we all know. We still recommend somewhere between 40 and 45 if you're a normal risk patient. If you have an elevated risk for breast cancer, see your doctor and they'll advise you of when to start that mammogram. That may be earlier. The other new thing that we had, even in the middle of this pandemic, we have a new technology at Jefferson Radiology for mammography. We have a new artificial intelligence program that we actually run every mammogram through. And it's amazing. It finds very tiny findings, and it helps doctors kind of hone in onto those findings. Again, kind of the goal is really to find the breast cancers when they are the tiniest, to really try to avoid like larger treatment things like chemotherapy. We really want to find those cancers early. So this program actually helps the doctors read faster because they're looking through a lot more images, and then it helps them be more precise. We can find 40% more breast cancers just using the 3D alone. And then with this new AI technology, we think we can probably get another bump of maybe 5–10% plus. To my knowledge, we're the first place in Connecticut to have that technology. But I believe other places around the country, and certainly in the state, will also adopt that technology. We're really excited in the state of Connecticut. Finally, all 3D mammograms are covered by insurance. That became state law last year. And then new this year, any woman that needs a screening breast ultrasound because she has dense breast tissue, that's also covered by insurance. So we're super excited by both of those initiatives in the state of Connecticut. And they'll really help women stay on a regular screening program, which is fabulous. In October, if you go to Hartford Baking Company and you buy any pink treat, Hartford Baking Company and Jefferson Radiology will each donate $1 to the American Cancer Society.